Hi, I'm Meghan Romig, and I'll be performing a focus assessment on a patient today. Patient is male, 16 years old, and Caucasian. His present occupation is a student in high school that does babysitting on the side. His usual source of medical care is at the doctor's office a few miles away from his house. Chief complaint, ear pain and mole on patient's face. History of present illness. He started not feeling well on March 19th, complaining of a bad headache and ear pain, and rates both on a pain scale as an 8 out of 10. This pain has been going on for 3 days now, and he has tried to get rid of the pain by taking 4 Tylenol per day. He also is complaining of sinus pressure and a runny nose. When he was younger, he had pneumonia frequently and also gets severe headaches occasionally. All of his immunizations are up to date. He has no known allergies to medications. Patient had a hernia 2 years ago and got it surgically removed. He cracked his head open when he was 2. His only current medication is an inhaler called albuterol and uses it to help break up a cough when he gets one. Patient does not smoke, drink, or do drugs. He exercises 4 days a week, gets at least 7 hours of sleep at night, and maintains a balanced diet with many servings of veggies and fruit. Patient's parents are divorced, has lots of friends at school, he's not that religious, and is a bit insecure and concerned about his mole on his face. Family history for patient includes a paternal grandmother who was a survivor of breast cancer, a paternal grandfather who died of lung cancer, and a father with high blood pressure. Patient's vital signs fall within normal range for blood pressure, which was 116/78. He has a respiration rate of 14 breaths per minute and has a pulse of 80 pulsations per minute. The 2 high-priority systems we are assessing today is the head, eyes, ears, nose, and throat, and the integumentary assessment. Okay. Because the patient is complaining of an earache, headache, and sinus pressure, a head, eyes, ears, nose, and throat assessment is necessary. Patient has occasions of severe headaches. Patient cracked his head open at the age of 2 while falling off a chair onto a hard surface. Patient does not complain of dizziness and has never fainted. Patient has never experienced vertigo. He does not complain of any neck pain and has no limitation to motion in it. There are no lumps or swelling, but the submental and submandibular lymph nodes are enlarged. Patient has no history of hyperthyroidism. Patient wears glasses and has 10 out of 20 vision. Patient does not have any eye pain, no redness, swelling, watering, or discharge. Patient does not have diploma or glaucoma or cataracts. He is complaining of an earache in both ears and has had ear infections before. There is no discharge, but the ear hurts the patient a lot. Patient denies tinnitus. Patient says there is green discharge from the nose and has gotten severe colds before. He complains of sinus pain and mild nasal obstruction. Patient does not get epistaxis often and has mild seasonal allergies. Patient does not report of a change in his sense of smell as well. Patient does not report mouth pain, a sore throat, bleeding gums, toothaches or lesions in the mouth or tongue. He does not have dysphagia, no voice change, no altered taste, and still has their tonsils. I also performed a physical exam on the patient for this assessment. Patient has a normal size and shape to their skull. The skull also has normal skin tone, color, and facial features are all symmetric. Patient performed good range of motion in the neck and has no pain while the trachea and cervical vertebrae were palpated. The submandibular and submental lymph nodes were slightly enlarged, but the patient says they are not painful. His eyes close evenly and the sclera is white with no redness or irritation present. The lacrimal apparatus was not inflamed as well. Patient got a 10 out of 20 on the visual acuity test and passed the visual acuity test on the right eye. All of the extraocular muscle functions of both eyes work. The light reflected back in both of the corneas. The eyes did not deviate to the side when the cover-uncover test was performed. Both pupils are round, equal, reactive to light, and accommodate. Patient's ears were then palpated and inspected. The inside of both ears were inflamed with some fluid. Patient passed the Whisper, Rhine, Weber, and hearing test. The patient also passed the Romberg test for balance. The nose was then inspected and palpated with irritation inside the nostrils. Both the frontal and maxillary sinuses are both inflamed. Patient's lips are not chapped and can open and close the jaw at the temporomandibular joint without any pain. The buccal mucosa, teeth and gums, tongue, and floor of the mouth are not inflamed. The tonsils are slightly inflamed, so they are graded a +2. The hypoglossal, glossopharyngeal, and vagus nerves all work in the mouth as well. Alright, moving on to the integumentary assessment. Because the patient was concerned about the mole on their face, an integumentary assessment is necessary. Patient has a mild acne and overall has even pigmentation of the skin. The mole on his face is asymmetrical, a dark brown color, and has a small diameter. Patient only gets dry skin on hands when the temperature outside is colder. Patient does not complain of pruritus, which is itchiness, and does not get excessive bruising. Patient does not claim of having rashes or lesions. Patient is not on any medications for the skin and does not report any hair loss or texture change to the hair, and has no abnormal change in the nails. He is not in any environmental hazards or occupational hazards. Patient keeps good hygiene by showering every day and washing their face. I also performed a physical exam on patient for integumentary system. Patient's general appearance looks clean and groomed, and he has appropriate body language. There is even hair amount, shiny color to it, even distribution, and is not brittle on the patient's scalp. His skin is clean, moist, has even pigmentation, normal texture, and even thickness throughout. There are no lesions or scars present. The skin has an even temperature bilaterally. The skin has good turgor, and there is no edema present. The nails are nicely trimmed with a normal pinkish color to them, good thickness, and are attached to the nail bed. Capillary refill for every fingernail and toenail was less than 2 seconds. Alright, moving on to the pertinent systems. I assessed, according to the American Academy of Neurology Press Quality of Life Guide, migraines and other headaches, it is important that the patient gets a neurological exam if they are experiencing highly frequent headaches. And then the other pertinent systems, respiratory. According to the Pediatric Respiratory Medicine by L.M. Taussig, it is important to perform a respiratory assessment because of the patient's history of having frequent pneumonia as a younger child since patient is still a minor.